After understanding nature, severity, pattern, and types of TKR pain via various physiological and biochemical processes before, during, and after surgery, let's determine suitable pain management strategies. We are always striving for the pain control. Have we conquered the pain? The worldwide burden of pain has actually increased over the past century. Attitude always matters while feeling, dealing, or healing the pain. Patient feels pain as a passive acceptance in negative situation. While dealing it, we should feel as positive attitude in negative situation. A, B, C, D, E are very important component of effective pain management that include assessment of a pain using pain scale, believe in patient, choosing appropriate pain control modality, delivering them in logical manner, and empowering or enabling patient in self-control. The strategies for pain management has been evolving from the era where pain was underrated or era of oligoanalysia with relatively less use of opioids due to fear of its side effect known as opioid phobia, then transitioned to the era where opioids were used in huge quantities in various forms due to aggressive marketing of pharma companies. Subsequently, after addition of new concepts like multimodal analgesia, inclusion of regional analgesia, preemptive analgesia, the pendulum has begun to swing from the opioid sparing to the era of opioid-free anesthesia. In this decade, new techniques will probably be introduced to replace existing conventional blocks. The pain generation is the interplay between noxious stimulus, nociceptor, and central nervous system. It involves conversion of continuous noxious stimuli into pain signals, and then transmission of pain signals through the pain pathways and perception of actual pain at the central level. Thus, pain treatment protocol should reduce noxious stimuli by addressing causative factors like inflammation and nerve injuries, interrupt pain pathways by blocking the transmission with the help of regional anesthesia techniques, modify pain perception at the central level using various analgesic drugs mainly acting on the CNS level. To involve all these goals, the ideal pain management strategy would be multimodal analgesia for multifactorial pain. A combination of various pharmacological agents, non-pharmacological techniques, and regional analgesia techniques constitute the concept of multimodal analgesia. In MMA, various categories of the drugs are given by various routes of administration having various mechanisms of action on various types of receptor, decreasing side effect of each category. MMA should start with the preemptive analgesia that plays a major role in perioperative pain management by inhibiting central and peripheral sensitization. It significantly reduces the intensity of the postoperative pain and decreases the incidence of hyperalgesia. Psychological analgesia is also an important aspect of multimodal analgesia, aiding in resolving psychological concerns and postoperative pain management. Psychological factors like stress, anxiety, and fear can affect the experience and magnitude of pain. On the other hand, emotional well-being can affect the overall experience of pain, helping to understand the cause of pain and learning effective ways to deal with it. An address post-surgical pain initiates several neuroendocrine stress responses, leading to secretion of various hormones like ACTH, catecholamines, and ADH, resulting in increase in blood pressure, heart rate, prolonged recovery, and infections. Efforts should be made to avoid acute postoperative pain turning into chronic pain, since acute pain can be well managed, but chronic pain is difficult to manage. To conclude, the ideal pain management strategy for post-surgical TKR pain should be loco-regional, procedure-specific, motor-sparing, opioid-sparing multimodal analgesia for multifactorial pain. Thank you so much for listening.